This will help us revise certain cardiac conditions also. So this is the normal pulse pressure tracing. Can you comment on option number B, please? Option number B is a slow rising pulse. It's like a slow rising pulse, because it is a slow rising pulse with a delayed peak. So in those circumstances, I will be calling it an anacrotic pulse. So this gives me an opportunity to make you revise the ABCD of pulse. This is a slow rising pulse, also called as Pulsus Parvus at Tardus. And yep, the slow rise pulse would be that of valvular aortic stenosis, which is well known by carotid thrill and also presence of a ejection systolic murmur, where the intensity of the murmur will increase and then gradually will decrease. So they can just make you, like they can give a pulse and say for the corresponding condition, what is the murmur that would be heard? Well, it's a crescendo, decrescendo murmur. If you plan to draw this, then the intensity will be max in the middle of the systole and then will tend to go down. Then you can see pulses which are gonna be having two speed breakers. Instead of saying percussion wave, tidal wave, I'll say like this. Let me say this is speed breaker 1 in systole, this is speed breaker 2 in systole, and this is also speed breaker 1 and speed breaker 2 in the systole. But you can see the height of the two speed breakers is different. This would be for valvular aortic regurgitation. This would be a collapsing pulse that is present. So Bisferiens word is okay, but like the question would be primarily from the perspective of what is the valvular lesion that is associated. So if they give you the speed breaker 1 and speed breaker 2 of equal height, then you will say that this is going to be valvular aortic regurgitation, where the pulse will tend to collapse. And if he's going to be, kind on me, he might even mention the word pistol shot sounds on femoral evaluation of the patient. That is one. And another feature that can be given is like Quincke sign, dancing carotids. In case of valvular aortic stenosis, it is carotid thrill, and here it is dancing carotids that would be given in the question. And along with that, it would be an early diastolic murmur. Instead of drawing it, I'm just highlighting the terminology here. That would be EDM, that is early diastolic murmur. So the size of the two peaks is almost equal. But if they give you a situation when there's going to be two like speed breakers in the phase of systole, but the size of both of them is not equal, then this goes in favor of hypertrophic cardiomyopathy. Now for this hypertrophic cardiomyopathy, the technical word is that this would be a subvalvular aortic stenosis. This is a subvalvular aortic stenosis in a patient. So the question would still be which heart valve is involved, but everything else with the dynamics will change now. Earlier it was aortic regurgitation. Now I'm saying the word subvalvular aortic stenosis. So here the correlation would be that the murmur that is present would be ejection systolic murmur. And the highlight of this murmur is that this murmur will increase with Valsalva.